Good morning. My name is Tim Nanoff, and I'm the Federal Affairs Manager with the American Occupational Therapy Association. We're the national association representing the interests of more than 140,000 occupational therapy practitioners across the country and the people they serve. AOTA represents occupational therapists and also occupational therapy assistants, who have different levels of preparation but serve the same goal of meeting patient needs. Occupational therapy, or OT, is a profession dedicated to the improvement and maximization of function and performance so that people can live life to its fullest and avoid or overcome injury, illness, and disabilities. Several consumer groups are represented on the panel of speakers here today, and I wanted to highlight the importance of addressing the therapy cap perspective from the perspective of someone with traumatic brain injury, which is another group dramatically impacted by the cap. Traumatic brain injury, or TBI, as it's often referred, is a condition that relies heavily upon occupational therapy as well as the other therapies to return individuals to their maximum levels of function and participation. A Medicare beneficiary with traumatic brain injury, regardless of whether it resulted from a car accident, a fall, or other event, tend to need therapy to relearn their communication, physical, and functional skills necessary to complete important activities of daily living, such as bathing, dressing, and eating. Occupational therapists help people with TBI to implement strategies to minimize the effects of short-term memory loss, functional and cognitive impairment, so that they can get on with the primary and more complex daily tasks such as self-management, self-care, money management, and even job skills that allow them to lead productive, satisfying lives. Before coming to work at AOTA, I was a direct service social worker for about 10 years in Maine and also in Arlington County, Virginia, and Washington, D.C. So I had some direct experience working with occupational therapists in the field, even though I was a social worker, and working with Medicare-age beneficiaries. The goal of my intervention and the goal of the occupational therapy intervention that these patients received was to keep them comfortably and safely at home. And occupational therapy helps seniors to find and utilize assistive devices and technology to keep them safe from falls and to recover from disabling conditions like traumatic brain injury, among others. These conditions can often result in hospitalization or unwanted institutionalization without access to the appropriate mix of all the rehabilitation therapies, including occupational therapy. Before I close, I wanted to change hats for a second and speak as a co-chair for the Health Task Force of the Consortium for Citizens with Disabilities. CCD is a coalition of approximately 100 national and disability rights organizations working together to advocate for national public policy that ensures self-determination, independence, empowerment, integration, and inclusion of children and adults with disabilities in all aspects of society. Many of the groups here today, including AOTA, are also members of CCD, and I want to acknowledge that coalition's long-standing support for addressing the therapy cap. CCD includes both consumer and provider organizations, but consistently focuses on policy issues from a disability perspective to ensure that that population gets the attention they deserve from policymakers. CCD, as a coalition, joins with the group assembled here today and strongly urges congressional action to address the cap, not only for 3 weeks, but for at least a year and for a permanent resolution, so that people with disabilities, regardless of age or condition, can access the therapy services they need under Medicare. I would add that although the majority of beneficiaries on Medicare are obviously seniors, CCD would acknowledge the many younger individuals that receive Medicare and rely on Medicare for the services that they need. Finally, in recognition of the new media and social networking impact on policy and decision making, I'd like to direct the press and staff here today to a Facebook page dedicated to stopping the therapy cap. In just over a couple of weeks, the page Stop the Medicare Therapy Cap has received over 2,000 followers. And this is a site which provides an opportunity of a public message board or a wall that provides unique insight on how that therapy cap is impacting patients and providers alike. It also provides an informal way for advocates to share concerns and stories about the therapy cap. I urge you all to take a few minutes today to take a look at that page. Thank you for your interest in righting this wrong, and I look forward to answering your questions on behalf of AOTA or CCD. Thank you.